What are the nicotine withdrawal symptoms you may experience when you quit smoking? How can you manage them? Hello everyone, this is Dr. Air, addiction specialist. Before we get going, subscribe to this channel and hit the bell button so you get notifications on new videos that can help you quit cigarettes and live smoke free. Now on to nicotine withdrawal. As I'm sure you know, nicotine withdrawal symptoms can be very uncomfortable. This may be your greatest fear when you think about quitting cigarettes. Let's talk about the physical and psychological withdrawal symptoms and how long they last when you stop smoking. The reason it is important to know this is because it will help with your journey to quit cigarettes. Some people have symptoms that the worry may be due to a physical illness when in reality it is due to quitting cigarettes. So if you know this, then you understand that it is part of the quitting process and you're not panicking about having developed a physical illness. What this means is that you're better prepared to go through the process of quitting smoking. Yes, nicotine withdrawals can be uncomfortable, but does it have to be painful? It doesn't. You see, the way you experience your nicotine withdrawals depends on a few factors, such as your mindset, whether or not you're taking directed action, and also your overall health. And I know you likely have tried in the past to quit, but did you put things in place to make this process easier and more sustainable? The reason I ask this is because if you plan accordingly, you are more likely to succeed. So what is nicotine withdrawal? This is the recovery process you experience when your body gets rid of nicotine after you stop smoking. This process is geared towards your body becoming healthier. One question you may have is, how long do the nicotine withdrawal symptoms last? Well, this is variable and depends on several factors. So what I'll talk about today is more of an average timeline. I always advise speaking with your physician if you have any concerning symptoms. There are several symptoms you can develop when you stop smoking. It does not mean you'll have all of them, but it is helpful to at least know what they are. Nicotine withdrawals tend to be more psychological than physical. Even if the physical symptoms are not as severe as opioids or cocaine, for instance, it is uncomfortable and can be a nuisance. Withdrawal symptoms tend to be most intense for about 7 to 10 days and then they drop off sharply and gradually improve. The first 5 days tend to be worse as this is how long it takes your body to clear out the nicotine completely. So let's talk about the first withdrawal symptom, cravings. Cravings are the physical compulsions or the urges to use nicotine. The prominent symptom of cravings is the overpowering desire to smoke a cigarette. Cravings are normal and is a major cause of relapse. In general, they tend to decrease in strength and frequency over time. Cravings do not indicate that there is a problem. It does not mean that you're unable to manage your desires or that you're weak. Nicotine has a short half-life. This means nicotine cravings can start about 30 minutes after your last cigarette and they usually last about 15 to 20 minutes. They tend to come in waves. They build up, reach a peak and then subside. Because of its short half-life, nicotine clears from your body almost completely after 5 days, and as a result of this, you may experience the peak of physical withdrawals like headaches, difficulty sleeping, and cravings. After 5 to 7 days, most of the withdrawals and cravings you experience are psychological, that is, mental. And what are these mental cravings? They are simply thoughts and feelings about smoking that make you want to grab a cigarette. An example will be the thought that it would be nice to have a cigarette right now. There are different ways to manage your cravings, including identifying and managing your triggers, mindfulness, urge surfing, CBT, cognitive behavioral therapy, medication-assisted treatment, and a mindset change. These are some of the cardinal principles we discuss in the Directed Action and Mindset Formula. You can find a link to our program below. Let's talk about the second symptom, fatigue. You may experience a lot of tiredness during the initial 4 weeks after you stop smoking. One theory suggests that this is related to a brain chemical called acetylcholine. When you smoke, nicotine binds to acetylcholine receptors in your brain. This makes your body decrease the natural production of acetylcholine. When you stop smoking, there is no longer nicotine to bind to the receptors in your brain, and your acetylcholine levels are not as high as they used to be. This causes you to feel tired. The good news though is that over the next 4 weeks or so, your acetylcholine levels gradually normalize, thus helping with the fatigue. I have, however, had people tell me they continue to experience fatigue even after several months. Also, smoking increases the carbon monoxide levels in your blood. When you stop, your body begins to get more oxygen, and it may take some time to get used to this new change. It is thought that this process also contributes to the fatigue, headaches, and dizziness you may experience. Smoking also increases the release of chemicals from your adrenal glands. These chemicals are norepinephrine and epinephrine. Epinephrine is also known as adrenaline. These chemicals put your body in a constant state of stress and tension. So when you stop smoking, your body adjusts to the change, which may lead to tiredness. Nicotine can also affect your body insulin and increase your blood sugar levels. This means your blood sugar levels can drop initially when you stop smoking, thus causing you to feel tired. To help with the fatigue, headaches, and dizziness, continue getting good rest and sleep, drink more water, eat healthier, and exercise regularly. Let's talk about another symptom, sleep disturbance, also known as insomnia. You may struggle to sleep properly in the early days and weeks after quitting. In fact, some studies show that this can affect up to 50% of people who try to quit. Sleep hygiene tips can be helpful. Examples are having a set bedtime and wake-up schedule, avoiding electronic devices 1 hour before bedtime, exercising regularly, and avoiding alcohol and caffeine late in the day. Let's talk about appetite and weight gain. Some people gain as much as 5 to 10 pounds within the first few months of quitting cigarettes. There are quite a few theories on why people gain weight after they stop smoking. It is thought that smoking increases your metabolism, which then slows down when you stop smoking. This weight gain tends to reverse itself within about 6 months as your metabolism goes back to normal. Nicotine also appears to act as an appetite suppressant, which means you tend to eat less when you smoke. After quitting, however, you feel more hungry and eat more as a result. When you quit smoking, your sense of smell and taste improve, so food smells and tastes better. In addition, cravings feel like hunger pangs, so you may find yourself eating more when you have nicotine cravings. Nicotine increases dopamine in your brain, and when you stop, your body looks for other ways to increase dopamine. Food, especially carbs and sugars and other sweets, can stimulate an increase in dopamine levels, which makes your body crave them. Note though that the act of quitting smoking is not what causes weight gain. The weight gain comes from eating more. So you want to stock up on healthy options, watch your portion sizes, and get active. On to another symptom, poor concentration. This is likely due to cravings as well as the carbon monoxide and oxygen changes to your blood when you quit. Also note that when you have other withdrawal symptoms like headaches, dizziness, fatigue, restlessness, and anxiety, your concentration will also likely suffer. Let's talk about coughing and chest tightness. This can last for several months. You have to understand that smoking over several years will lead to an accumulation of toxins within your lungs, and when you stop, your lungs attempt to clear them out. So the cough, phlegm, and chest tightness you experience is actually a healing process. Making sure you stay properly rehydrated by drinking lots of fluids can help with this process. Please see your doctor if the symptoms are severe or persistent. Let's talk about constipation. This can be an unpleasant symptom for the first month when you stop smoking. The solution to this is to increase your fiber intake and drink lots of water. Eating lots of fruits, vegetables, and foods rich in fiber will help significantly. Consider cutting down on junk and processed foods and adding fiber supplements to your food and drinks. Also, exercise regularly to help with your bowel motions. Anxiety and depressed mood are symptoms you can also develop when you stop smoking. This can last for several weeks after you quit. Note though that smoking on its own can cause anxiety, as it causes the release of adrenaline, and of course there's also the anxiety that comes with developing cancer and other illnesses when you smoke. So even if you may have increased anxiety initially when you quit, over time your anxiety should get much better than it was when you smoked. Also, remember that nicotine causes the release of dopamine, which makes you feel good. When you stop, dopamine level decreases, and this may make you feel sad or even depressed. Dopamine is a protein, and it takes some time for your brain to produce enough and get you back to normal levels. It can take even up to 3 months before things get back to normal. If you previously had a history of depression and anxiety, it is important to follow up with your mental health provider. Irritability, frustration, and anger can also occur when you stop smoking. Many people feel this way for up to a month, and this comes from changes in your brain chemistry as your body adapts to life without nicotine and tries to get back to normal. Also, if you have come to see cigarettes as a companion, it stands to reason that you may feel some irritation when it is no longer present. Getting support, exercising, sleeping properly, deep breathing, keeping busy, and getting involved in a new hobby can help with this. You may find quitting cigarettes challenging, but think of all the amazing benefits that come with it. It is very important to prepare for this journey before you actually quit. Preparation makes it more bearable and sustainable. The DAM formula, our proven roadmap to quit smoking and live smoke-free, gives a step-by-step framework on how to achieve this goal. Remember that quitting is one thing, staying smoke-free is another. Living a smoke-free life is totally worth it. You feel better, smell better, look better, save money, and save your loved ones from secondhand smoke. As you proceed on this journey, you can get support and free tips from our free Facebook group called Quit Smoking Success Group. You can find the link below. If you enjoyed this video, subscribe to our channel and share this video with others who may need help to quit smoking. Speak with you soon.